Wow, honey, look at that eye. Oh my goodness, green. Yeah, pretty. Looks so good.
Hi everyone, today's the day. Sadie Grace has her little red coat on and she's ready to go. We hope you'll join us to visit the veterinary ophthalmologist that Sadie Grace's vet referred her to based on the findings of a small cataract during an eye exam he recently performed at her last checkup. You won't want to miss this. We'll take you right inside the actual consultation. Oh, poor Sadie Grace. It's gonna be okay, honey.
You okay back there?
She'd be a lot better if it was warmer. I mean, well, it's 8 degrees Celsius. I wouldn't call that warm.
I don't think she finds it warm either.
No, I know. Well, it's a damp 8 degrees Celsius. Very damp. You'll warm up, okay, honey? You're gonna be good. Sadie Grace has been with us for a year now, and I've been observing more and more discharge and gunk around her eye. I've also been noticing that sometimes she seems to have difficulty locating her toys that she asks me to throw for her, especially in low light. With only having one eye, it's normal that her depth perception is not what it used to be. But my dog mom instincts have been working overtime as of late, which is why I felt compelled to share my concerns with her vet at our last consult.
You okay back there? Oh, she's shaking.
Robin and I would hate for her to develop a problem in her one remaining eye that goes unnoticed or untreated. It's important to take a proactive approach so as to safeguard her vision as much as we possibly can.
How you doing back there? You okay? She looks sad.
She is sad. She senses something is up.
They're gonna do an eye exam.
If only it were easier to treat dogs' vision problems.
Yeah.
If only our pets could tell us when something is wrong. That's why we're so thankful for the incredible work that veterinarians do.
How you doing back there, little sweetie? You okay?
Oh, she's okay. She's okay. Well, look at that. We got a prime parking spot. Okay. Oh, my heart is beating a little faster. Sadie Grace, your mama gets as nervous as you do. Okay.
She'll be better in a moment when mommy's picking her up.
I'm gonna grab her. Okay, honey. Okay, you ready? Are you ready? Okay. Yeah. Oh, sweetums. Oh, she's jumping into my arms. Okay, I'm just gonna put your leash on, okay? Is her coat crooked?
No, it's just hard to get through. It is actually a little crooked.
Yeah, you know what?
Her thing's not on.
I'm gonna take the coat off because she got really hot the last time inside when we took her to the other vet. Okay. Okay, let's just go like this, okay? Okay, you coming, Daddy?
Yep.
Sadie Grace's consult is with Dr. Veronica Feigel. She's a board-certified veterinary ophthalmologist at Capital City Specialty and Emergency Animal Hospital in Canada. Hey, honey, see how much you weigh?
6.5.
Okay.
All right, you can take a seat. I'll just check in and they'll be around to see you shortly, okay?
Thank you.
You're welcome.
She's shaking so much. It's okay.
When all this is through, and till I hold tight on to you, we'll just head down, carry on, 'cause what else can we do but get through, and we'll sing
It's okay, Mommy and Daddy are with you.
It's freaking my heart that she's shaking.
When we were called in the examination room, we had a friendly meet and greet with Dr. Feigel. I shared what I know of Sadie Grace's health history, recounting the tragic way that she lost her right eye before coming into our care. I also shared the story of how we started as Sadie Grace's foster parents last year, only to fall so fast in love with her that we adopted her. This has become a favorite story to tell. Dr. Feigel explained the various forms of testing she would be doing on Sadie Grace, starting with the Schirmer tear test to determine if she suffers with dry eye syndrome. Although it looks uncomfortable, this is a painless test that uses a strip of special paper to measure tear production.
And lots of tears. That's great.
Oh, good.
You're such a good girl.
Yeah.
Little angel. This is the second Shih Tzu today that's had the little
top knot?
Yeah.
Okay. Wow, honey, look at that eye. Oh my goodness, green. Yeah, pretty.
Sadie Grace's eye is green because fluorescein stain was dropped into her eye to help identify any corneal abrasions, scratches, and ulcerations. This stain also helps reveal if her duct is draining properly from her eye to her nose.
Looks so good.
Good girl. Good. So now we're gonna rinse it off.
Okay.
Yeah. Good girl. I know. Yeah. Such a good little girl. Little angel.
Good girl.
Well done. One more little rinse. Good girl. Sweet girl. Yeah. There we go. So good.
Good job.
Okay. Here, so that's what we're going to use the most up to go through all this. So if you were to cut the eye in half and look from the side, that's the front of the eye and that's the back of the eye.
Okay.
So the cornea is the clear window on the front.
Yeah.
Then we have the anterior chamber, which is a fluid-filled chamber. The iris is the colored part of the eye that opens and closes to create your pupil. The lens is a structure here that focuses light onto the back of the eye. Then we have the vitreous, which is a jello-like substance sitting at the back of the eye. It helps keep the retina in position.
Okay.
The retina is the next layer. It's the nervous tissue. And then we have the optic nerve that attaches essentially the eye to the brain. So it takes the signal, goes all the way through, and then the optic nerve takes it to the brain.
Yeah.
So when I look at her eyes, there's basically three changes that I'm seeing. Again, all very minimal.
Okay.
So the first is on her cornea, so the clear window on the front of the eye. Right at the inside corner, she has a bit of what we call pigment. So there's this wisp of brown that's coming in there. And so it's in the superficial part of the cornea. So you see there's a few layers to it, and this top layer is called the epithelium. And so the pigment is just involving this top layer.
Okay.
And so what happens is that pigmented cells or brown cells love to live at the limbus, which is where the white part of the eye meets the cornea. So right out here, these pigmented cells like to live. And specifically in the inside quadrant, when we have dogs with this type of conformation, which we call brachycephalic ocular syndrome, which essentially just means their conformation, where they have larger eye openings, where they don't close all the way down, leaving sort of the central part to be more exposed. And sometimes, not so much with her, but their inside lower lid can roll in a little bit. They can have some hairs that sometimes have contact, so as they need to be groomed, little hairs will have contact with. And so all those factors together lead to some chronic irritation in this area, which allows then those pigmented cells to sort of grow onto the cornea, so with exposure. So right now it's minimal, and it's just right at the edge, and that's why I was asking her age, because you know, depending on how old they are, then that's kind of more significant if we have to worry about this spreading. Because certainly corneal pigment can it starts at the inside corner, and it can continue to progress across the surface of the eye, and if that happens, that can lead to vision compromise.
Okay.
So with her, it's very minimal right now,
Okay.
but certainly we don't want it to progress.
Yeah.
So that, along with another thing she has a little corneal scar in the center. It's a tiny little cloudy spot.
Okay.
And that's just to me indicating that in the past she's had a little scratch to the surface of her eye that's healed over,
Okay.
and it's just resulted in a little scar.
Okay.
Again, if you look at where in the quadrant of where that little scar is occurring, it's again in that central part where she probably doesn't always blink all the way down. So even when I put on the drops on her eye, the stain, and you kind of go to rinse it, then you kind of have to pull her lids over because she has such a prominent eye.
Yeah.
And so again, these factors, these changes are just showing us this conformational change.
Okay.
And so what I'd like to do is, and I do this for all, Shih Tzus, pugs, all these dogs with this type of conformation, is we start them on artificial tears. Even if it's something over the counter. And basically just minimum 3 times a day, morning when you get home from work, or if you're home midday,
Okay.
and then before bed, you can put it in every hour if you wanted to. So if it's a windy day where you think she might have more exposure, you can put it in more frequently. But the purpose is simply we're trying to bring more moisture to the cornea so she doesn't blink all the way down. At least we're trying to protect that area, because the concern is not only this pigment can progress, but also she could develop another ulcer.
Okay.
And so I always tell people, when you think of your lips or your skin in the winter, if my lips are chapped, I don't need someone to come up and cut me, right? They just spontaneously breaks apart. And the cornea is the same. It's a version of skin. It's what we call non-keratinized skin. So if this cornea dries out, it can become chapped per se,
Yeah.
and they can develop a little scratch, and then if that happens and the wrong bacteria gets in, they can get an infected ulcer, which I see all the time in these breeds. They get a little ulcer, it gets infected, and then we have a bigger thing on our hands. So lubricating it is certainly the first step in trying to minimize those risks.
Okay.
So that's something I would recommend she be on long term.
Okay. Make sure it's preservative free.
That's what I usually
Yeah.
recommend, because they seem
Yeah.
to be less irritating.
Yeah.
Although, I had a client earlier today that brought up that whole issue in the States. So there's like the one brand of preservative-free drops that were made in India that were contaminated and caused
Yes.
massive. So,
Yes.
but
Heard
we
about
certainly
that.
have not encountered
Yeah.
any of that
Thank
with the
God.
main ones.
Yeah.
We also, we have veterinary ones only, the high-quality ones. I typically use those, you're welcome to, but they're a little bit more expensive.
Yeah.
And so for just everyday use, over-the-counters are fine.
Okay.
So I'll put that on your report.
Okay.
So that's the exterior. Again, it's not shocking to me because of her breed.
Yeah.
The discharge that you sometimes see it might also be helped if we put some artificial tears.
Okay.
Because again, if her eye gets a little irritated because it's dry, she's
Yeah.
going to have more mucousy discharge just from irritation. So,
Okay.
so that's the external part. In terms of inside of the eye, she does have a tiny cataract, but it's very small.
Okay.
So if we move into the eye now, into the lens, so that's the structure here. So the lens has a skin or capsule that goes all the way around, and then inside are the lens fibers. And so the lens fibers need to be transparent for us to see, or for them to see. And so what a cataract is when the lens fibers become opaque, so they turn more white. And we can have varying degrees of cataracts. So in her case, she has on the front of her lens sort of this very faint little strand of opacity. It's very small, so if you kind of look at from the front, it's just this whisper of a strand. So it doesn't really affect her field of view. I still have a nice clear view from the front of the eye to the back of the eye.
Okay.
I can see her retina very clearly.
Good.
So that's telling us, although yes, this may be a little bit opaque, her overall vision is good, her
Okay.
field of view.
Good. Good.
With her being around 6 or being 6, with this cataract, it's most likely genetic in nature.
Yeah.
Whether it progresses, it's going to be hard to say, but certainly just someone should track that going forward.
Okay.
Every 6 months to a year, to just see if we start to see it progress. Because if it does to progress to involve more of the lens, because that's often what cataracts do,
Right.
then it can cause not only vision changes, but it can cause inflammation in the eye, which can be irritating, but can also lead to other more vision threatening things such as glaucoma and
Yeah.
retinal detachments.
Yeah.
So at this moment, really there's no treatment required.
Okay.
In dogs, we do cataract surgery all the time, but we wait until their vision is significantly affected to do it. So in her situation, we wouldn't
Yeah.
do it at this point. We would
Okay.
just monitor. If you wanted to be super proactive, and I'm not necessarily saying you need to do this, but there's nothing we can do with drops or anything like that that will prevent the cataract from progressing. The only thing that can be used is there's a supplement called Ocular. It was developed, a vitamin supplement developed by some veterinary ophthalmologists in the States. It's been used, for many different things. One of the things being potentially reducing the rate of progression of cataracts. So again, her cataract's so small. Would it be wrong to use it? No. Does she really need it? Probably not. It doesn't really seem to cause any side effects. Most dogs tolerate it really well. I'll put it on your sheet. If you want to read about it, you can Google it and their website. And then if you decide you ever want to use it, great.
Yeah.
Again, it's a supplement, so I always tell people, can I promise you it's going to do anything? No.
Yeah, it's kind of like us with our coenzyme Q10, right? Like, is it helping our brain health?
Exactly. So again, I'm mentioning it more just to be as thorough as I possibly can, but please don't feel it by me saying, oh, you should really start this. Like the lubricating drops, I strongly suggest and recommend because I know that that's going to benefit her.
Yeah.
The supplement, I'm again mentioning it to be thorough, but it comes down to your comfort level. So I'll put it on your report, read about it. We carry it here. I think you can even order it online.
Okay.
Fair
enough.
And other than that, her eye looks great.
That's good. Like, this is really, I was really worried. I thought we were going to be leaving here with a surgery.
No. So all is good news. So I suspect that the things you're seeing might just be, if things hit her on the other side.
Yeah. Her positioning.
Exactly, because overall the eye looks fine.
It's very, very good news. It's relieving. Thank you.
Great. No problem. It's a pleasure to. It's always good to give good news.
Yes.
Such good news.
Yeah. So it's great. Yes, I'm glad you brought her in because certainly I think the lubricating drops are going to benefit her.
Yeah.
And then whether the cataract is tracked here or with your vet.
So they don't have her quite ready to go on here, so just give me a moment.
Okay. To go home now. There, okay. Mommy got it. I just want to Velcro you so you stay warm, okay, honey? Yeah. There you go. Okay, honey. You're all good. You can relax now, okay, sweetness? We're so proud of you.
How you doing, little sweetie?
She's good.
That wasn't so bad.
That wasn't bad. They were so nice. So nice.
And they all loved you.
Oh, yeah.
Well, what's not to love?
That's right. So we're gonna go home and have a treat now? Oh, yeah. Oh, yeah. She's ready. She wants to go home and have a treat because she was such a good girl. Yes, honey.
And a few belly rubs.
Oh, I was just gonna say she gets at least 3.
3 belly rubs for you.
3 belly rubs in a row, huh? Yeah.
How's that sound?
Okay. You ready to hit the road? Yeah? Okay, honey. We're so proud of you. What a good girl.
How you doing, little sweetie? How you doing? You okay back there? Oh yeah, she's good. She's much better now.
If you enjoyed this video, please like it and feel free to comment below. We'd love to hear from you. You can also subscribe to our channel. Be sure to hit the bell button so you'll be alerted each time we post a new video. Be well, and we'll see you next time.